Welcome to this education program. Today, Dr. Venkateswarlu, he is a senior most interventional radiologist. He is going to tell us what the hysterosalpingography is. And he will going to discuss not only the benefits, how the technique is being done, and what all things we have to follow during the procedure. So I am Dr. Power. I request Dr. Venkateswarlu to describe the procedure of hysterosalpingography, which is in simplified way called as HSG. Welcome, sir.
Today what we are discussing is a X-ray based hysterosalpingogram. So what do you mean by hysterosalpingogram? Hysterosalpingogram means assessment of uterus and fallopian tubes. To assess morphology of endocervical canal, uterine cavity, tubes, and to rule out any tubal occlusion and abnormality like synechiae and uterine abnormalities. So what are the indications? Indications are infertility. Infertility can be primary or secondary. And also we can evaluate the tubes after tubectomy and post-reversal status of the tubes. So there are some contraindications. Generally, when you suspect the pregnancy, that is a rule of 10. So these procedures should not be advised between maybe 11 to 14 days because there is a period, there is a chance of pregnancy. That's why unless you rule out pregnancy, you should not do a hysterosalpingogram test. Other thing is if there is a history of any acute pelvic infection, so and active bleeding, so and recent surgery, that is DNC, so you should not undergo HSG. And some history is needed regarding any contrast sensitivity. So in these cases, there should be some information to the person who is doing the procedure, or should inform about mainly any earlier drug sensitivity, mainly the contrast medium.
And there is one school of thought that we should use some antibiotics, painkillers, or medicines which relax the tubes. What is your opinion on this?
Antibiotics are not routinely necessary unless there is a suspicion of some hydrosalpinx or some pelvic infection. Those situations, it may be helpful. Otherwise, it's a simple procedure, and antibiotics are not recommended in this type of interventions.
So it's not mandatory that
the
patient should use antibiotics. Okay.
And what are the various imaging modalities that are used to image the infertility workup? So one is fluoroscopic, which is what we do is a fluoroscopic virtual hysterosalpingogram, that is virtual CT, virtual MR, and sonographic procedures. There are so various, SIS is one, various sonographic procedures, and endoscopic, that is hysteroscopy, and laparoscopy. But non-fluoroscopic X-ray hysterosalpingogram is not recommended actually, ideally, but unfortunately most of the HSG are done under only X-ray machine. There is a radionuclide hysterosalpingogram. So there are so many procedures that assess the infertility work.
The point here is that the HSG should be done under fluoroscopy, not a simple X-ray machine. So that is very important. All patients should be aware that there are two ways of doing this procedure. One is plain X-ray, where there is no fluoroscopy. Fluoroscopy is nothing but like a TV. We can see real time. We can visualize the whole thing, how is the uterus, tubes, and everything. So always it should be done under fluoroscopic guidance for better evaluation of the uterus and tubes.
It is called, if you do simply with X-ray, it is called conventional X-ray technique. And what we use generally is fluoroscopic technique. Just a comparison, X-ray machines are compared to a still camera. So that's why the cost may vary, because the procedure cost varies depending on the cost of the equipment. So simple X-ray costs around few lakhs, just like a still camera. If you compare next, Like a fluoroscopy machine is expensive. It may cost up to ₹1 crore also. Just like a video camera, it is definitely costlier than the still camera. So hysterosalpingogram is a century old. I mean, it was done in 1914, and the contrast used was varied. The contrast media changed over a period of these 100 years. Next. The first done by the Rubin. Yeah. So one highly contrast media that is called lipidol is very expensive. Suppose you are doing HSG with this contrast media, the contrast itself costs around 22,000. So if you do a hysterosalpingogram with that, the cost of the process is very expensive. So we rarely do with this contrast. So we always use a water soluble contrast media, which is cheaper. So when the procedure should be done, that the procedure should be done during the follicular phase, that is day 6 to almost day 11. So this is the period one should undergo the procedure.
So every patient should be aware that the test should be done on from 6 to 11 day of the menstrual cycle. That's very important so that you can avoid any pregnancy related complications. So that is the ideal period which we should do this test.
Yeah, procedure is no specific preparation is needed. During pre-procedure analysis, antibiotics are given depending on the indication, and generally it is done under no sedation actually. Rarely anesthesia is required. GA. So that is a simple procedure. As the patient comes, the patient on the table, and preparation is done. Okay.
When do you use sedation, sir? When do you require?
When the patient is, most of the time these processes are very anxious actually, and they are fearful. So when the patient, the person want to undergo, they cannot tolerate the pain. So in those situations, we can advise them, use them under sedation. Otherwise, not necessary.
So ideally, there is no need of any sedation. If the patient is apprehensive, well, as such they are not conceiving, they will be more apprehensive. In those instances, maybe they require sedation. Otherwise, there is totally sedation-free investigation of the HSG.